This is The Broken Shift with Nurse Natalie. Healthcare doesn't break in chaos, it breaks quietly. This is The Broken Shift, where healthcare culture gets examined, not excused. Because sometimes it's not the policy that tells you everything, it's how people are treated inside of it. I saw something recently that honestly didn't surprise me. Not at all. But it should have. It would have been nice if it did. A message was sent to staff telling CNAs to stand against the wall. Not because of an emergency, not because of patient safety, but because of space. And the more I sat with it, the more I realized this isn't about chairs. Now, let's be fair for a second. Anyone who has worked in healthcare knows some nurses' stations are small. Rounds happen, doctors need space, things get tight. That part. That's real. But here's where it shifts. This one hit different for me because I've lived both sides of this. I've been the CNA, being told where I can stand, where I can sit. Like my body didn't matter. And then I became the nurse. And I saw something else. Sometimes we couldn't sit either. Because when doctors came to round, the expectation was clear. They needed the space. So the nurses stood. And if the nurses are standing, you already know. The CNAs aren't sitting. So now we have to ask the real question. Who actually gets to rest in healthcare? Because what I started to notice was this. The higher you go, the more permission you have to sit. Have you ever worked somewhere where sitting felt like a privilege instead of a basic need? Drop basic need in the comments if you know what I'm talking about. This is what people don't talk about enough. Healthcare isn't just stressful, it's structured. It's structured in a way where one level absorbs pressure and then passes it down. Physicians need space, nurses adjust. Nurses lose space, CNAs get displaced. CNAs get displaced, dignity gets compromised. And over time, this doesn't just affect workflow. It affects how people treat each other. Because something subtle happens here. When you've been controlled long enough, you start to normalize it. And then one day, you're no longer the one being told what to do. You're the one giving the instructions. And if you're not aware, you repeat it. Have you ever caught yourself doing something that was once done to you that you didn't like so much? And now you were at the top of the hierarchy and you just did it without even thinking. And listen, this is not about blaming nurses because nurses are under pressure too. Short staffing, high acuity, constant interruptions, no breaks. But acknowledging pressure does not excuse disrespect. There is a difference between, hey, we're tight on space, can we shift things around? And stand against the wall. It's basically saying stand against the wall because you don't have a degree. One is communication and the other is control. Have you ever been told something that wasn't technically wrong, but still felt disrespectful? Drop disrespect in the comments if that's happened to you, or at least if you've seen it happen. If space is the issue, then solve the space. Solve the space. Pull in chairs, rotate who sits and who stands. Create seating in the hallway if needed. But what you don't do is remove someone's dignity because of their title. That's reprehensible. If you were in charge of that unit, how would you handle that situation differently? I'd love to hear it. Because this isn't just about CNAs. And it's not just about nurses. It's about the culture we are participating in. A culture where rest is earned, respect is ranked, and dignity, it's negotiable. Do you think healthcare has a hierarchy problem or a communication problem? Let me know in the comments. Because at the end of the day, a healthy system doesn't decide who gets to sit based on status. It makes sure that everyone can stand and rest without losing their dignity. This is The Broken Shift. And if you've seen something like this or experienced something similar, you can send your story anonymously to TheBrokenShift@gmail.com. My name is Natalie. Because these stories, they matter more than people think. I'll see you in the next one. Healthcare culture doesn't change when we ignore it. It changes when we're willing to examine it. This is The Broken Shift.